Morning everyone. My name is Belen and this is Brian Vitualla. Here is the presentation regarding our technical analysis paper, COVID-19, the denial of implementing mass testing. As we proceed with our introduction, coronavirus disease 2019, also known as COVID-19, is caused by the severe acute respiratory syndrome coronavirus 2. With the increasing amount of cases, every now and then, governments and institutions have different approaches in handling the worsening effects of the pandemic. In order to understand the research, we must learn about the background of our specific goal. The most prominent approach used by the countries to combat this virus is the mass testing. It is a project that intends to control the spread of the virus by identifying patients who are infected with it. It has a different interpretation and approach when it comes to various countries, in accordance to their financial and medical resources. However, the circumstances brought by this project makes it difficult to conduct and fund these project operations. As Roque perceives the term in his statement, no country in the world can test every single one of the people, and that they can only test those who needs to be tested, not just because they wanted to. Therefore, it is subjected as targeted testing, which focuses on places that are in dire need of testing kits. Now, as we focus on the thesis statement, although mass testing allows for immediate quarantine and treatment, and cautiously released lockdowns, it still should not be conducted because it may be used as a tool for discrimination. It has limitations that will lead to inconsistent results, and the availability of our workers along with our financial and medical resources here in the Philippines. I will now present the arguments that we have chosen. To sum it all up, the first argument is that mass testing may be used as a tool for discrimination. As stated by Singh and Subedi, healthcare providers and recovered patients are facing from discrimination, and many of these people have been denied access to the community in fear of these people carrying the virus once more and transmit to a larger amount of people. The second argument of this research is that mass testing has drawbacks which will lead into inconsistent findings, as to which, according to Oswe, is that middle and low-income countries struggle to implement widespread testing due to limited testing capacity. This includes lack of skilled staff, health workers, ill-equipped laboratories, and supply chain bottlenecks, which means it is a barrier preventing supplies from reaching the full capacity of a harmonious process. Finally, as we go with the third argument of the research, it is the fact that mass testing relies on the availability of the workforce along with financial and medical resources here in the Philippines.
For our counter-argument statement, mass testing enables for instant treatment and quarantine, and tentatively releases lockdowns. According to our first evidence of Jones 2014, there are three tangible ways to address health equity that combats racial capitalism. Firstly is valuing all individuals and populations equally. Next is recognizing and rectifying historical injustices, and lastly, providing resource according to need. While there are limitations in terms of medical kits, it can be prevented by earlier diagnosis and treatment, support by mass testing. According to our second evidence of PETO 2020, the virus can only survive for those who are untested. That certain crises would improve by earlier detection and by having all the staffs and patients tested regularly. As for our analysis, there are articles that supports the implementation of mass testing proves to be effective on other countries. According to Cohen and Kupferschmidt 2020, Other countries had conquered the virus without such drastic measure. An example is South Korea, which is confirmed that from 909 cases, it drops to just 74. Instead, the key to success has been a large, well-organized testing program, together with extensive efforts to isolate infected individuals and trace and quarantine their contacts. As for our refutation statement, mass testing is not certain that it can help control the virus. In fact, the implementation of mass testing has its limitations. For the first evidence by Stoddart Hall, 2020, that the virus is extremely contagious and has a long and unknown transmission window, which could last 10 to 14 days. When illness is non-distinct or during asymptomatic incubation, stealth transmission occurs. These factors create control problems that differ from those associated with the disease, such as smallpox, which form much of the law and policy precedents we have for restrictive public health actions. As for our second evidence, according to the British Medical Journal, 2020, false alarms and missing cases are created by mass processing or mass testing. The inaccurateness of the results is worsened by monitoring by unskilled workers, self-testing, and the medical kit's reliability. As for our analysis, the effectiveness of mass testing is not reliable as the evidence points out that the transmission of the virus could be stealthy, which occurs during asymptomatic, which can lead to spreading the virus before it is being discovered. The evidence also states that the false results and missed cases are caused by all mass testing procedures. The inaccurateness of the data can also be caused by unskilled testers and inconsistent quality of the test kits, which adds to the fact that mass testing is not that effective for controlling the virus. So, for our conclusion synthesis, thus mass testing enables immediate quarantine and treatments for positive patients of the virus and cautiously release lockdowns, but still, we forcibly oppose the implementation of mass testing since this can be an instrument for discrimination, it has limitations to it that will lead to inconsistent results and the accessibility of health workers, financial, and medical supplies here in the Philippines. Now, for our final impression, though implementing mass testing for COVID-19 has its benefits, however, it is vital that we must know its disadvantages, which shows that it is more favorable than the advantages of it that may lead into controlling the virus problematic. So, in conducting mass testing and during its process, we should think of others equally, especially for most Asians since they are the origin of the virus. However, as a matter of fact, we cannot avoid discrimination. Also, there will be tendencies during the process that the results will be inconsistent due to the mislabeling of the data and the reliability of the testing kits. In order to conduct mass testing, we must be financially stable, meets the required health workers, and has the proper equipment. As the Philippines cannot meet these requirements, therefore, it is not applicable to the Philippines to conduct mass testing as it will only lead to unacceptable outcomes. So that's all. Thank you for watching.